guys, welcome back to my YouTube channel. If you're new here, karibu sana sana sana, and for my returning subscribers, welcome back. Leo niko na mgeni. As you can see, tuko na new environment, si ya kawaida. Na tuko na balls hapa, tutawaelezea all this what is going on. Yeah? But at first, my guest will introduce herself.
Yeah, so I'm Antoinette. I'm a physiotherapist based in Upper Hill, and I have a clinic in Fortis Suits, third floor 301, and it's called Align Care Upper Hill Physio and Lab Limited. And yeah, welcome so that you can learn one or two things.
Okay, asante sana kwa kutukaribisha pia hapa. You might have seen her on Felicity Shiro's video, YouTube channel. Yeah. You did a session with her.
Yes, I did a session with her regarding the pregnancy. So yeah.
Okay. Now, before we go far, what is physiotherapy?
So physiotherapy is a rehabilitation discipline in science that deals with rehab on people who have difficulty doing their normal daily living activities, and mainly it's they're disrupted by the pain or even disability that is causing them not to be functional during their normal daily living activities.
So who needs
and then it's so wide, so so mainly there is orthopedic physiotherapy where you'll find people who have musculoskeletal pain and or people who have had accidents. That is actually categorized as orthopedic. And then there is also under orthopedic there's also rheumatology. That's when you have degenerative diseases like arthritis. You also deal with that. And there is also in OBS and Gyna, we do Lamaze classes to pregnant women, and that basically just strengthens the back and also prepares the mothers to give birth. There's a way we prepare them by learning relaxing the muscles, but mostly it's breathing. You see, they normally tell women that you need to breathe like this and then you push.
But do you remember that?
I know, but at the back of your mind, you'll always like, there's something I was taught.
I was taught something.
And then also the positioning on, if you're doing a normal delivery, you also do that.
So this helps?
Yes, it normally helps a lot.
Does it shorten the labor period?
It helps in opening the pelvic. Most of the exercises just to prepare you for delivery. And then with the back exercises, that is very important because you have to strengthen your back during delivery, before delivery, and even after delivery. And then you'll find many women complain of back pain after delivery because they didn't measure so much in Lamaze classes or doing the exercises for the back to strengthen the back. So when you're pregnant, all the way shifts.
It goes
down and in front. So it changes the base, the center of gravity. So with that, your muscles on the back, they're overstretched, so they're not contracted. So they become relaxed in a way.
So you've talked of the normal delivery. Do you do the same also for mothers who? Those who choose, not even choosing, those who know I will undergo a CS. We also do that because even if you do CS, you'll find you'll always need back care because of that, the weight of the baby and then the shift of the center of gravity. So definitely your muscles are in tatters, so you have to do back physio. And also you'll find there's some mothers who get complications after. Even after normal delivery or CS, they might get incontinence, they might get... What is incontinence?
So incontinence, there are various types of incontinence. So incontinence is when you cannot hold your urine. Or when you're about to go for your short call and you're not able to push the urine out. That's a type of incontinence. So it holds. So it can either be held in the kidney or
You cannot hold.
Not kidding, in the bladder, or you cannot hold. So it just comes out.
It just comes out.
Yeah.
Oh. I think so many women.
And there are so many things. And then many women suffer.
And they don't know.
You'll find some get a prolapsed rectum. Like you'll find women who have had CS, or immediately after CS, they get to remove maybe the uterus. Yeah, so that space has to be filled by something. So you'll either find the rectum falling down, and then they'll always feel heavy when they stand up. They feel heavy near the vagina. They feel like there's something heavy. That is definitely a prolapsed rectum.
We are not told these things.
Yeah, I know, but most people who take out the uterus, they might be having either they'll get a tendency of getting maybe cancer, or they have a lot of fibroids, so they just tend to that fibroids that might turn to be cancerous, so they opt to remove the uterus. Yeah.
Oh, okay. And I think so many women don't talk about these things.
Yes. And then it's so private.
It's a bit
it's so private. You feel like if I talk about it, how will people take me? But they need to be sensitized. Yes, they need to be sensitized. And then there are people who have specialized with women health. There's someone who is going to talk about that women health.
Awesome.
Yeah, so she will be able to guide you through on what they normally do.
Okay.
Yeah.
Now back to
my physio.
To your physio.
So physio with the rehab, and then many people, and the main problem in human body concerning musculoskeletal, they always complain of back pain, and it's rated the most occurrence in all over the world. People complain of back pain. And then let me use this.
Wow.
Yeah. So
this is the
normal backbone.
Backbone.
Yes.
Fine. Wow.
These are the bones of the back. Okay. And then you see the bones the way they are lining. This is the neck. This is part of the head. And then these are neck bones, and then the mid back, and then also the lower back and the sacrum. So with a normal back, you'll find someone having the way this cadaver is presenting, and then there's no like osteoarthritis or degeneration on it. But you'll find as we grow older, you get people who, because of their sitting for long hours, they tend to have their bone moving forward, like the way this one is appearing. So with this, it causes pain in the body.
Okay.
So, or rather, if the disc is pinched, if the disc has gotten or is subjected to too much pressure, now the disc starts popping outside.
So this is the disc?
Yes. Okay. So now this is a disc, but this is a disc that has already popped out the jelly part of it. So the disc has fibrous part of it, and then in the middle, it's jelly. That's why if you take an X-ray, if you take an MRI, in between the disc, you find it's a bit whitish. That's something jelly. So if it's subjected to too much pressure, it tends to press, and then it prolapses like that. Okay. So with that, it tends to press on the nerves. So let me use this other one.
Wow.
Hold for me this. So can you imagine if discs comes out, or it's subjected to too much pressure, and then it bulges on outside the bones. So it's not supposed to be in that position. So it will press on this nerve. That's why you find people complaining of they have back pain. If it's a bit severe or advanced, you find them having pain either on the butt or down towards the leg. Yeah,
especially this is the butt. Huh?
Yes. So this one is where the uterus sits. So the butt is out here.
Okay.
Yeah. Yes. So you see these nerves, they come out and then they go and supply to the legs. Okay. Same thing to the neck. There are nerves that comes out from the neck, and then they supply to the hands. That's why you'll find those people complaining of pain, numbness, or tingling sensation, or someone complains of a burning sensation, and it can either be general on the whole limb, or they can draw for you a line showing that it's presenting like this.
Up here.
Yes. So you'd find area. Like the upper, not even the upper butt area. It's a nice one. So this is the part of the lower back. And then the butt muscles, they come and sit and attach here, like that. And also the other side. So any tension on this back, even if there's no radiculopathy or pain down the leg, you'll find them having pain all the way up to the hip and the lower back area. And some will even present pain all the way up to the upper back. So any tension here or any condition that it's presented on this part or any other part on the backbone, it will always go to the muscles surrounding that area.
Okay.
Yeah.
Oh. So we should be sitting upright.
Yeah. Actually, and then these days, you'll find people saying, "Oh, I bought an orthopedic seat. It will make me sit right." No, that is not the case. Even if you have an orthopedic seat or you have this other seat, if you don't sit well, definitely it will be of no good use to you. Okay. So you have to, even if you get an orthopedic seat, you have to get you need to know how to sit. How your working desk should look like. Yeah, and that's why these seats were made at 90 degrees, not if we were meant to sit like this or even this way.
Like this.
They could have made the seat slanting, but they knew we need to sit in 90
degree angle. Yeah. That's the correct posture.
Yes.
Okay.
Yeah.
And you should be exercising as well?
Of course. And then, when you sit for long hours in the office, people go in the office early morning at 8. And then they tend to sit until maybe lunchtime.
Yeah.
And they'll go warm the food and eat at the same desk.
Yes.
So that is very impactful to the body. And then you'll tend to shorten your muscles. That's why you'll find people complaining of back pain. And also office workers, when you complain of back pain, you have to also work on your hip pain or on your hip muscles because of that long hour sitting. So we have to release those muscles. That's our work of physio. Yeah. And then there's something I mentioned about arthritis.
So you also deal with arthritis?
Yes. So we have, like with orthopedic, there's an orthopedic doctor who works. I work with, he's called Dr. Oburu. He works as an orthopedic surgeon and he guides people on orthopedic issues. Okay. And then when it comes to arthritis, there is Dr. Oyo, Professor Oyo, who is a rheumatologist who works with arthritis guys. And then arthritis is wide.
Yes.
There is that arthritis that is autoimmune. Autoimmune basically means your body starts fighting itself.
Okay. What is that?
Now the cells of your body start fighting themselves. It's an autoimmune. The cause of it is unknown, but that's how it behaves. So, and then these arthritis for degeneration, maybe after a fall or even after an accident, because of the wear and tear of the joint, the bones have to grow. So those bones that grow on the surface of the joint, on the joint surface, it causes osteophytes that causes osteoarthritis.
Okay.
And then there's osteoarthritis for elderly patients because of the age, the normal wear and tear. We are all heading there. We'll one day have arthritis on one point or another, or rather, we might be having arthritis in our body. Arthritis is not bad. The thing is, how strong are your muscles?
Okay.
How flexible are your muscles also? So you'll have. Let me tell you one thing. If you take these the marionettes, the ones who hit the rocks for building, and even the builders, believe me, if you do their MRI and X-ray, for a normal person, you'll send them direct for an emergency surgery.
Really?
Yes, but because of their work, their muscles are so strong. They never complain of these pains.
Yeah.
But the moment they stop now the work, because of maybe they've retired from building, now they start sitting at home or doing any other thing that is not involving the muscles so much, that is when the pain sets in. So that simply explains that your muscles needs to be strong.
So you need to now keep on exercising. Yes,
you need to keep on exercising, and then also you're supposed to do physio to release tension on the muscles, and then that's when you do exercise, you'll not be limited by pain. So this is a basic thing. I'll talk about the knee. So when you look at this there are 4 types of knee. These are normal knee for any other person. I'll not use normal person because all of us are normal. For any other a healthy person. So this is how the cartilage appears. It's very smooth. And then in between there's a meniscus that prevents friction in between the 2 bones. So when you have nice joint like this that is very healthy, this is how it appears. So when you have a fall, or when you go to the gym and then you strain, it now keeps on a bit, it chips out, like the way this part appears. So this is very mild. You'll find when you go to a doctor, then the doctor tells you that you have mild arthritis. Now this is how it appears. Okay? And then after that, when you go without any intervention, it chips more. When you look here, it chips more. Okay? And later, if you neglect it, this is how it will appear. So as you see,
it's disappearing.
Yes, the cartilage is actually wearing out.
Yeah.
So when the cartilage wears out, believe me, the bones start crushing each other, and when they crush each other, they have to heal.
Painful.
Yeah, and they have to heal. And when they heal, they will heal in this manner. So another bone grows on top of it to cover up that space.
Oh, I can see the difference.
So you can see the difference between here and here.
Yeah.
So now this is very severe. And most cases, when it reaches this point, physio cannot help. So you have to do a surgical intervention called total knee replacement. So you have to visit an orthopedic surgeon who will be able to cut this part and then smoothen it out and then fix the artificial knee replacement gadgets above and below. That's why you can be able to move without any pain.
Wow.
Yeah. Okay. So why wait until you reach there? Yes, we will reach there one day. But why wait until you reach here? Yet you can be able to
get help
before it reaches this point. Yeah.
And can the supplements help?
So about the supplements, you'll find like women, for us, we lose a lot of blood during our normal monthly periods. So the estrogen in our body reduces, and then estrogen works hand in hand also with the bones in the body and how strong they be. And then you're subjected to low estrogen, then yes, you'll have wear and tear. So when it reaches that point, that's when it's good when you take the estrogen. But you'll find people tend to run for supplements very early. Yet, when they grow older, they'll still need it. So instead of running for supplements so early, yet you can buy time until when you're older, that's when you'll be forced to take the supplements.
Oh, but is there harm in taking supplements earlier? Like now
there's no
in
harm.
our 30s?
There's no harm. But what are you teaching your body? That you need to keep on taking supplements. Yes, with the supplements, the body is able to take the amount that it needs. But why can't you take them from normal food? Even if you take a supplement of, let's say, if you have effects or if you have a condition concerning maybe bone density, that's when you need the supplement to improve on your bone density. But if you don't have any bone density issues, or you don't have low vitamin D, why should you take? And yet you can get vitamin D from the sun. Yeah. So it's very important. Use the supplements at the right time. Yeah. Even though your body is built in a way that it will only take the required amount and then dispose the remaining. But if you can be able to buy time, it's good.
Okay.
Yeah.
Wow, we've really learned a lot.
Yeah, this is about, and it's so wide actually. That is about arthritis. And then we also deal with geriatric patients.
With what?
Geriatric patients, the older patients.
Oh, okay.
The reason as to why you find, I don't like associating myself so much, comparing ourselves with the US or UK, but I'll have to say this, that they take their parents to a geriatric home, home for the elderly. And in those homes, their parents have their normal medication they normally take, even plus the supplements. And they have nurses around. They have physios around. They have doctors around. They're able to be monitored.
Yeah.
That's where you find them. Their mortality rate for all elderly people, it's not so much because they're well taken care of.
Yeah.
But for us, when you get our parents, they're at home.
Wow.
And you'll find you come from home, let's say you come and work either in Nakuru or Nairobi.
Yeah, they're left at home.
Yeah. No one is taking care of them.
No physio.
I've seen it I've seen it with my patients. It's not good to talk about it, but I have to talk about it. You find a patient comes when the arthritis is so severe,
So bad.
in a way that physio cannot help. So they just have to do surgery. And it's so sad that you find even young parents, as young as, let's say, I believe 50 is young to have a knee replacement. Not unless it's so necessary for you to do the surgery, maybe after an accident. That is normal cases. Yeah.
But in Africa, I think most of our parents cannot go to the nursing home.
I know.
That's now.
So it's our job now to
enlighten
care and take care of them from their homes. If they're not comfortable going to
a nursing
home, it's good they have like community-based rehab. Yeah, where they'll have physios. Even with
once in a while.
There's this thing called what? Devolution. This is devolution. So they even the governors, they need to work with the Ministry of Health so they can enlighten people on community-based rehab. Yeah, that will really reduce the chances of, and then this causes a disability, and then someone cannot be so effective, and also the economy of the country will not grow.
Sure.
Yeah. Okay. So that is about geriatrics, and then we also see patients for neurological conditions, like if you've attained stroke, you've gotten Parkinsonism, and also Parkinsonism is also an autoimmune disease. The reduction of something, I'll not give out the names, the dopamine. So that it causes neurological conditions. You'll find also people who have maybe multiple sclerosis. We also give them, the big terms. So we give them rehab so that it can prevent they can prevent disability or contractures on the joints. Also, just for maintenance. But for stroke, we give them rehab so that they can gain back their normal daily activities. I don't know if you've ever seen a stroke patient who has attained stroke, and then you see them later, they're able to walk. That is purely physio.
After physio?
Yes, wow. Yeah. And the earlier you start it, the better.
The better.
Yeah.
Okay.
Yeah.
Wow.
Yeah. And then also we talk about, we also see pediatric patients. Pediatric means you'll find with peds also they still have the orthopedic issues, they have neurological issues, but rarely arthritis, but a particular type of arthritis called rheumatoid arthritis. That's when you see it in young kids. Okay. So we manage the same way. Yeah.
Wow. You really do a lot.
It's wide. Physio is wide. Yeah. It's not just about one condition like back pain. It's so wide. Yeah.
So if someone has back pains or knee
pains, shoulder pains, they should come. They should do physio. Yeah, because it helps a lot by increasing the joint space and also conditioning the muscles around the joint. That prevents the shearing of the joints, preventing arthritis. Yeah.
Okay. Now I've seen you have a lab.
Yeah.
What do you do in the lab?
So we have a lab called it's still under the Upper Hill Physio Lab, and they deal with every condition that needs to be tested. So there's some tests when they do, or when they take a sample, they have to send it outside the country, maybe in South Africa or India. That's when they can be able to take it out to do the test, and then they get the results within a week or 2 weeks, depending. But basically they do test anything that needs to be tested in a lab.
Oh, like maybe even arthritis.
Okay, there are markers for arthritis that you're able to see. The ESR, there's so many things. There's ESR, there is there is ESR, there is the protein content, the amount of protein in the body that
so you do a blood
detects if you have an inflammation or not. Okay. There's so many things, the ANA, there's so many tests that are supposed to be done with arthritis.
Okay.
Wow. So that you can detect the level of arthritis that you have in your body.
Okay.
Yeah.
So for arthritis, there's a blood test and there's
there
also
is urine.
An X-ray.
Yes.
Urine.
Yeah. They also measure urine. Yeah. So there's so many things.
Okay.
Yeah.
Wow.
Samples are so many. You can get a sample from either urine, you can get a sample from blood, you can get a sample from the bone marrow. It just depends. The CSF, the fluid in the cord. Yeah.
Okay.
Or a piece of meat on your body.
A piece of meat.
Yeah. I'm used to it. Let's say a piece of muscle or just actually it's a meat. Yeah, it is.
So you cut off.
Let's say if they have a patient comes in and then they have maybe a lump.
Oh. Okay.
And then they think maybe there's some query that lump might be cancerous. They will not know if that lump is on the body. If it's cancer, they have to take a piece of it.
A piece. So now I get
so that they can go and do their test.
A piece of meat sounded scary.
I know. Let's use muscles instead of meat.
Well, now we have some balls over here.
Yes.
What do you use them for?
So when you see these balls, it's used in so many conditions. First, pregnancy. I actually bought this balls because of pregnant women, because I give out Lamaze classes. And then we can use them for even strengthening exercises. Yes. Okay. Be it the shoulder, be it the back, be it the knees. So there are different ways to work with it.
I think I know the jumping on it.
I know, but you don't jump. You don't jump on it. There's a way you have to control the movement. If you jump on it, it won't help.
Okay.
Yes, it won't help. So there's a way you have to sit and stand on the ball. There's a rhythm in it. Yeah.
Okay.
Yeah. So that it can be effective. Yeah.
Okay. So I think we've learned a lot today.
Yeah.
So for people who are pregnant, for people who maybe have been hurt, they've undergone maybe an accident, all that.
Or even an injury in the gym. An overuse injury in the gym.
Even in the gym.
Yeah.
Okay. And is physio the same as the massage you get in the spas?
In the spas? No. I wouldn't say it is the same. But for us, we deal with... there's part of it. On a layman's language, you might think it's massage. Yeah. So it's a soft tissue manipulation where you find some knots or the fascia which is entangled. You work on it so that you release it. There's a way you release it. So if a normal person comes, they will just know this is a normal massage. But you'll know the difference when you walk into a spa and you do the massage, and you come, you do physio, and massage is just part of it. On my layman's language, you'll know the difference.
Okay.
Yes. And then also we give out, there's a difference between just a normal massage and a sports massage. Yes, we also give out sports massage. I've worked also with, I've been privileged to work with also Athletics Kenya under Jessica. Yeah, Shiraku, she's the owner she's not the owner, she's the head of physio in Nairobi Hospital. So she's the one who has exposed me to sports. So yeah, and I've been privileged to work with the sports guys. So there's a difference between normal massage and a sports physio.
Sports, I'm thinking it's more intense.
It's more intense and it's more specific.
Okay.
Yes, it's very specific and intense. Yeah.
All right. And what else? I think that
is basically that. Yeah.
Oh, wow. You can tell us. You told us you're located on Hospital Road.
Yes.
Hospital Road is the road near Kenyatta Hospital.
Yes. Just off 5th Ngong Avenue. Many people know 5th Ngong Avenue. If I don't know. Yeah. They know that building called 5th Ngong Avenue.
Okay.
So just on the opposite road. off Ngong Road. That's where the road is located. And the building is called 46.
Okay, I'll include their contacts and the location down there. Yes. So you can visit them. And they can also call?
Yeah, they can give a call. And in case they need a referral to an orthopedic, I can give them Dr. Oburu's number. If they need a pediatrician, I can give Dr. Kitui, or even a gyna. I can give out Owiti's number, so that they can be able to be guided well. After they get the referral, that's when they can come. Or even you can come, they can walk in and ask for any inquiries. I'll be able to guide them.
Okay. Yeah. All right. Yeah. What are your charges?
So I charge 2,500 per session. And that is in the clinic.
Okay, the session.
Yes. And it takes 40 minutes to an hour.
40 minutes.
Yes. Yeah, and then with the session of physio, it entails so much. It entails that soft tissue work. There's some mobilization. You work on the joints to make the joints that don't move to move, and strengthen the joints that move so much that shows the muscles are not strong enough. So we strengthen those parts of the joints.
And the stiff muscles as well.
The stiff muscles, we work on them to release it so that it can loosen out. And you'll always find when you have tightness on one point, let's say this is a joint, definitely if you have tightness here, and then you'll find most people complain back pain because they have, you might find you have stiff muscles on the back muscles because of the spasms, but the muscles are weak.
Oh, okay.
Yes, and then there's a lot of motion here. So we'll find, when you find a part that moves more, there's definitely one part which is very stiff.
Very stiff.
And if you only treat this part and you leave the one which is stiff, and this works as a unit, so you will not be working on anything. You'll not achieve the desired prognosis. The pain might reduce, that's okay, but you've not handled the root cause of it.
So instead of using the deep heat, so when
they just apply deep heat, they feel like pain has reduced. No. That's just a problem postponed.
Oh,
yes.
Okay.
Yeah.
So if we have backaches, we should come here.
Yes, you should come. Okay. If you need an intervention to see an orthopedic surgeon or a rheumatologist, I'll be able to guide you. Yes, you also work with a rheumatologist called Professor Oyo.
Oh, okay.
Yeah.
Wow, good session over there. So no more use of deep heat
and painkillers, Panadol.
This Fastam is very
many
effective.
People like Fastam because it's effective. That is true. In pain.
Yes, it's so fast.
Yes, it works very well. But that is a pain. That is a problem. Like if you have malaria and the malaria parasite is in your body, you have headaches, you have stomach upset
I keep taking
from malaria.
Panadol.
But then you take Panadol.
Yeah.
So that's just treating a symptom.
Yeah.
You've not treated the root cause of it.
The root cause.
So you'll find those people always, after the Panadol has faded out from the body, the symptoms come back.
Comes back.
Yeah. Until you treat the malaria, that's when you can be able to heal. Yeah.
Wow. Thank you so much for that.
Yeah.
So I think that's it for now. People will contact you in case they need your help.
That's okay.
You do house calls as well?
Yes, I also do house calls. And house calls, I charge 35 per session. And I'm able to carry my own tools for work, and then I go visit them at home. So it's 35 around Nairobi, let's say CBD, and then and let's say
CBD and its environment.
But when it goes outside, let's say like Yambu Road, let's say like I go even as far as Moranga to see patients at home. Ruiru, I charge them 4-5.
4-5.
Yeah.
Okay.
Yeah.
So you can always negotiate.
Yes, I can always negotiate. And then for sure, I get patients, and believe me, you'll find a patient who comes and they really want the physio, and they don't have the money.
Yeah.
I get them, by the way, and I'll assess. I'll just know. I'll assess and I will know. And then those patients, I give them free sessions. For sure, such patients, I give them free sessions. You'll find someone who. I remember I had a patient from Embu. She used to come. Yeah. And I used to see her. I see her and I don't charge her.
Oh, you don't charge? Wow, that is so good.
Yeah.
Wow.
Because she couldn't able to foot the bill, and for sure I saw it, and I was like, there's so many patients. There's so many patients whom I've seen them free.
Oh, wow. I can also bring a few.
You can bring a few. A few. I like that one, a few. That's okay.
From my audience. Maybe
Yeah.
I can ask, and then we can maybe we will communicate.
Yeah, and then there's people who can foot half the bill. Yeah.
Okay. Wow.
Yeah.
So guys,
in this world, you have to help each other.
Sure.
I know.
We need each other.
Yeah, and we need each other. True.
All right. Thank you so much for this session.
Yes.
My people will be calling you. I know they have parents. They know someone who needs physio.
True.
So now you know where to come.
Yeah.
Arthritis. Arthritis is, I think, on the
it's like a global thing.
Yeah, it's global.
Because definitely we were never meant to grow younger. We can grow younger on the face and everything, and all, but our bones, they wear and tear. Yeah.
Okay. All right. Thank you so much, Antoinette.
Okay.
I know we can go on and on.
I know.
Really,
it needs time.
It needs time.
Yeah.
Yeah. But you know what, guys? You can call her. You can visit her.
Yeah.
And they can reach you on
the office number or even my personal number.
Okay.
I'll be able to give you so that you can put it.
Sawa. I'll do that, guys. So thank you so much, guys. See you on the next one.